Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Hello, everyone, and welcome to the special edition of This Just In Radio. I'm your host, Justin Barnes. Today, we're broadcasting live from ViVE2026 in sunny LA. Very excited to be here. It's already been an action-packed 36 hours since I landed. The prominence of this specific show grows every year, and I feel very fortunate to be able to broadcast annually from this event. Rich Scarfo and the entire health team are extremely supportive, and I'm tremendously grateful. I also want to make a special note of thanks to Roberta Mullen and Jake Reed for their support in helping me produce these ViVE broadcasts and recordings each year. They are terrific. This is actually my 12th year broadcasting live from a healthcare industry conference, and they helped make it my best year yet. So grateful for them and certainly my amazing guests. For today, though, I have a fantastic lineup of CEOs, CIOs, care providers, innovators, policy leaders, and visionary. If you miss any of this broadcast, all my shows are from This Just In Radio are posted at Amazon Music, YouTube, Spotify, Pandora, Apple Podcasts, iHeartRadio, SoundCloud, Spreaker, and the TuneIn platforms. As many of you know, my goal for broadcasting live each year from these key conferences is to create an information medium that shares best practices, strategies, and actionable intelligence from the industry's leading sources and experts. My goal, along with all my guests here, will be to offer tactics and strategies not only to survive, but to thrive as you navigate your hospital, your physician practice, your company, or even your family through all of these changes occurring across healthcare. There is more opportunity than ever before for all of us to thrive, but we must understand how healthcare is evolving, how policy and reimbursement is shifting, and where best practices and innovation can support our efforts. I hope you glean all of that over the next few days. That's at least my goal. Welcome back to This Just In Radio Show, broadcasting live from ViVE2026 in sunny LA. I'm very excited to introduce my next guest and great friend of the show, Dr. Ashwini Davison, CMIO of Oncology for AWS. Welcome back to the show, Dr. Davison.
Thanks so much, Justin. Yeah, so good to be here with you and everyone else at ViVE in Los Angeles.
Yeah, I just got a call here a moment ago, and of course, I've had to speak with back in the East Coast and around the country. He said, how's the conference going? And I said, this conference is full of basically decision makers, but also if you're a key executive in the industry, you're here. It's a very target-rich environment for getting work done, strategy done, thought leadership done, really engaging people who are making a tangible difference in healthcare today.
Agreed, Justin, with the CIOs and the executives that we've been meeting with so far. I think that events like this and what ViVE's been able to do is get everyone together at this time of rapid technology advancements in healthcare, because we're all upskilling together, right, with agentic AI and all of the potential that it holds. So thrilled to be here with everyone.
Absolutely. So before we dive in, what are you most excited about seeing in the industry today? What progress are you most excited to see today?
Great question. So this morning at ViVE, it was great to be on a panel focused on unified, personalized cancer care. I was alongside Dr. Caroline Chung from MD Anderson, Simon Nazarian from the City of Hope. So two NCI designated cancer centers, right? And we were talking about the rising rates of cancer diagnoses and the new patients that are generating more data, and yet we have a data problem when it comes to cancer care and research. So what I'm most excited about, at AWS, we really focused on supporting startups, pharma, life sciences, and health systems with data strategy. And I think that there's no more compelling of a use case than cancer.
No, well, it's absolutely true. I mean, I think you know this on the side. I've kind of dedicated 2026 to cancer innovation, a little bit of research, but also the optimistic message that technology and innovation is bringing to cancer care here in America. I'm sure we'll make it more global as time permits and goes on, but it's extremely exciting for what you guys are doing at AWS, but also what the Care Center, what Moffitt's doing. I love what Moffitt's doing, what CancerX is doing. I know it's not one of my questions, but I guess you've been instrumental from CancerX and with CancerX since the beginning. So share a little bit of your thoughts there about CancerX and the opportunity there.
Well, first, Justin, I'm so thrilled that, when we spoke at HIMSS last year, we were talking about the multimodal problem. So first of all, Justin, kudos to you on starting that additional series that's dedicated to oncology and cancer care. This month, was World Cancer Day in February, but it needs to be a year-round conversation, and folks like you and venues like this at ViVE are making that happen. I'm proud to be a part of the Cancer X Steering Committee. It's really the leaders in digital innovation for cancer care, and we're trying to support this ecosystem that's very much necessary to move the needle. So I'm speaking with Ashwini Davison, who I know you know well as well, EVP for Innovation and Advocate, and then Xavier Avant, who is also shepherding all of this work with Cancer X from Moffitt Cancer Center. And I think that together we can all tackle this problem because there's not just one problem when it comes to cancer care, there are many.
And we're going to make it a year-round discussion, certainly here at this Justin Radio Show. It's exciting. It's very important to your point. We don't want it to be one day. We want it to be every day. So I'm going to certainly do my part there. What are you seeing from healthcare and digital health trends? And obviously, in the panel this morning, you're part of a fantastic oncology panel here at ViVE. But what are you seeing as trends in the area of cancer care and healthcare?
Right. So one particular area where I think we should spend some time, Justin, is talking about the challenges with workforce burnout. Mm-hmm. We have a supply and demand issue, right? According to National Cancer Institute, every 30 seconds a patient in the United States is, let's say, getting a diagnosis of cancer, and yet we don't have the staffing that's needed, and burnout is increasing. So I think one particular startup that I find very promising is Rapt Health. Mm-hmm. And actually the leadership at Rapt Health, they used to be our colleagues at AWS. And what they've done is they've tackled a very specific and important problem in cancer care. Nationwide, 15% of appointments at infusion centers where patients with cancer go to get their medication, 15% of those appointments are missed.
Right.
Not only a challenge when you talk about delivering medication to patients who need it, but for the health systems, those infusion centers, that's an empty chair.
Absolutely, it's lost revenue.
Yes, and we want to keep those, systems going. So what Rapt Health has done is they've developed a software as a service solution on AWS native services, and in one deployment in California, they were able to reduce the no-show rate for infusion centers from 17% to 5% in just 3 months. So Rapt Health is the type of startup that I really think can make an impact because they're using AI, Justin. They're using the different factors that drive a missed appointment to maybe nudge the patient or help communicate with them utilizing Amazon Connect for patient engagement. So I think that's something that I find promising and definitely an organization to keep on.
That also leads to my next question. What are a few best practices in using AI and just the AI to meet patients where they are and really bring them along in their care journey? What are a few best practices that you've seen out there that you would like to share to help others navigate these trends?
Yeah. Great question. And Justin, actually at HIMSS, I will be joined by Rasu Shrestha from Advocate Health, as well as Rami Mejia from the SVP from Illumina. And we are having an executive track conversation about agentic AI and how to help it, and we'll be having a conversation about agentic AI and how it can revolutionize cancer care. As far as best practices, before we get to that workflow optimization and those improvements, data readiness has to be at the foundation. And so that's where at AWS we've really focused a lot on making sure that organizations can be AI ready, and that means not having your data in silos, right? It means getting the data out of those source systems, harmonizing it, and once you have that AI ready data foundation, then the sky's the limit when it comes to agentic workflows or augmenting the workforce and improving care for patients.
love it. And you touched on that at last year's HIMSS, which is now coming up in a couple of weeks. But just so you know, that specific discussion basically correlated with what I've been thinking for, it was 20 years ago when I was building a software company. We felt like we had so much data, even 20 years ago, 15 years ago, we had enough data stored in silos that we actually could cure cancer. We use it as an antidote if we just unleash that data and unleash all that siloed information. We're slowly doing that with interoperability, and that's actually where this whole cancer series came from, because then I got so excited last year at HLTH conference where Kamal and Manish and Dr. Jithwani and Dr. Parikh and I had a great conversation debating how far along we are in cancer evolution and curing cancer. Because I do believe if we can create the interoperability that you spoke about that a year ago, but if we, and you continue to speak about it, if we can actually continue to harness that, unleash that data, create that essential interoperability. You brought up FHIR interoperability on your panel this morning. Our next guest is going to be one of the founders of FHIR. So we've been all going down that path, but I do believe in my heart, uneducated, much more educated than you, because you're an expert in this area, but I believe that we have enough data stored in silos that we can begin to cure cancer at a much faster rate if we unleash that data. But I'd love you to share your thoughts on that.
Agreed, Justin. It's not a issue of not having the data. And in cancer, the reason that it's such an important space for us to all be leaning into is the average cancer patient might be generating 1,000 to 10,000 more data elements in a year than a patient with just diabetes or just hypertension. We know that the millions of those patients, there are more patients with diabetes and hypertension, but you're right, if it's in fragmented siloed systems, it becomes a challenge. And that's why AWS HealthLake, with its support for FHIR as a standard, is going to be so helpful for the new Pediatric Care Expansion Program, a $50 billion ARPA-H-funded initiative. We're really glad to be helping 197 pediatric sites, part of the Children's Oncology Group, Children's Brain Tumor Network, on board so that data can get out of the source systems for children at the time of diagnosis, and in near real time get into AWS HealthLake and be harmonized and utilized for decision making by the clinicians and researchers who can help those children when every second counts.
And that's the children, they're our future. Let's focus on energy there. You got a great stat in closing, with 30 seconds left. But we have not changed the rate that children, the lifespan of children in the last 60 years is 9 months. Give us 20 seconds on that stat, please.
Right, so DIPG is an example, diffuse intrinsic pontine glioma. 60 plus years ago, Neil Armstrong's daughter died of DIPG. And yet today, even with all of our advancements, life expectancy is 9 months after diagnosis for a child. We have to do better. But in order to do better, we have to get that data to be able to identify for this rarer condition what those patterns are historically. And so for examples like that, we're thrilled to be supporting initiatives like the Children's Brain Tumor Network and Pediatric Care Expansion.
Love it. Dr. Davison, thank you so much for making time as always.
Thank you for bringing attention to these important topics, Justin.
Thank you.
Take care.
Thank you.
Take care.